Hello and welcome. Welcome to this Raising the Bar discussion about how advocates can influence healthcare and improve equity. My name is Jocelyn Frye. I am the proud president of the National Partnership for Women and Families. We are a policy and legal advocacy organization that strives to advance civil rights, health, and economic justice. And it's truly a pleasure to be here with you today. At the National Partnership, our goal is really to explore a range of strategies to improve access to affordable, high-quality healthcare, to reduce and hopefully eliminate inequities in healthcare systems, and advance equity for patients and consumers, and particularly to focus on the challenges facing women, particularly women of color, who too often have been underserved in the healthcare system and marginalized and silenced in a way that reflects deep entrenched racism, sexism, and bias. We are so grateful to the Robert Wood Johnson Foundation for convening the Raising the Bar initiative and to really focus on how healthcare can approach what is often the stated goal of improving equity, and look at specific principles and strategies and roles and actions that healthcare organizations can take to begin to advance health equity in their work and all that they do. And as many of you know, in July, the Raising the Bar framework launched publicly to support healthcare leaders in all of these critical efforts around health equity. The National Partnership was extensively involved in the development of the framework, particularly in the case of addressing the issue of maternal health and child health. Hopefully, this initiative will help to explore and emphasize how healthcare can improve delivery in a way that addresses the challenges that many encounter in maternal and child health in a way that responds to individual needs, that addresses longstanding bias and discrimination, and ultimately improves the overall quality of services. And as many of you know, maternal morbidity and mortality in the US is unacceptably high. It often reflects the stark racial and ethnic biases that unfortunately are in our society, but are things that are preventable and things that we can address. And we are very clear that we can identify solutions that will save lives. And that is part of the work of the Raising the Bar initiative. Today's conversation is going to focus on how leaders, like many of you in healthcare, can transform their public commitments to take action and drive real concrete change, how you can engage community advocates and folks on the ground, and how they can play a really vital role in advancing equity. And I am so pleased that so many of you have taken time out of what I know are busy schedules to join us today. And now, as we get started, I have the real pleasure of turning the floor over to Anya Frazier, who is playing such a leading role and big part of raising the Bar initiative at the Robert Wood Johnson Foundation. So Anya, over to you.
Thanks so much for that introduction, Jocelyn, and to everyone joining us today. Again, I'm Anya Frazier from the Foundation, and we've supported Raising the Bar since its inception in 2020. And in my role and with my background of developing infrastructure and resources that benefit diverse communities, I have the pleasure of thinking a lot about how to move health and healthcare systems forward in efforts to raise the bar for equity and well-being. For years, the Foundation has been working to do just this, and we're still learning and evolving. The vision guiding the foundation's work in this area is for healthcare and public health systems to be fair and just, treat all people with dignity and respect, and rectify past harms and prevent future ones. To help in this regard, the Raising the Bar project provides an actionable framework for healthcare organizations to advance and coordinate equity efforts. At the foundation, we hear often from healthcare leaders like yourself who want to advance equity and be part of changing the system. We also hear that they know healthcare's roles must change, but don't know exactly where to start, and that their existing efforts feel a little disjointed. In thinking about this work, it was clear to us at the foundation that many of our grantees, that healthcare leaders both want and need a guide. That's why the foundation launched Raising the Bar. So Raising the Bar has been guided by a coalition of partners led by the National Alliance to Impact the Social Determinants of Health, also known as NASTO. This coalition did a wonderful job at driving the ideation, evidence gathering, stakeholder input, integration, and translation processes that resulted in the framework. No easy task. I think it's important to mention that Raising the Bar was developed by those who give, get, and pay for care, and was shaped by those who experience inequities. Raising the Bar takes a 360-degree approach to health equity. It's not just what a healthcare organization does in the community. It's not just how it treats patients. It's not just about the workforce. It's about approaching its work and roles differently. The framework, which you'll see a link to in the chat box, offers 5 cross-cutting principles that guide this work: 4 roles healthcare must play, and 14 actions that offer specific approaches to advance equity in your organizations. One of healthcare's 4 critical roles is as an advocate, realizing that healthcare's economic resources and influence can be harnessed as a positive force for payment reform, community well-being, and resilience and equity. A major part of this advocacy role is meaningfully involving communities, respecting and centering their expertise, needs, and priorities in governance and decision-making, and working in partnership with individuals and community organizations on activities and initiatives that reflect that engagement. So today we'll hear directly from advocates and healthcare leaders working to make this a reality. So back to you, Jocelyn.
Thank you so much, Anya, and thank you so much for your leadership, and again for the Robert Wood Johnson's leadership with the Raising the Bar initiative. And many of the themes you talked about are precisely the themes that we're going to discuss with our really distinguished panel that we have for today's discussion. And I will say both of our panelists are people who have lengthy resumes and at the same time, in many ways, need no introduction because they truly are leaders in the field. I'm going to give you a short bio and then we'll kick off our discussion. First, we have Dr. Kathy Baase. She serves as the board chair of the Michigan Health Improvement Alliance, a multi-stakeholder collaborative dedicated to improving health of people in 14 counties in central Michigan through the transformational initiative Thrive, which stands for Transforming Health Regionally in a Vibrant Economy. She is a member of the National Alliance to Impact Social Determinants of Health and the College of Health Sciences Advisory Board at UC Irvine. She was also part of the Raising the Bar Stewardship Council, providing strategic input into the Raising the Bar principles. Kotagal serves as Emeritus Professor in the Department of Pediatrics and Senior Fellow at the Cincinnati Children's Hospital Medical Center. Previously, she served as Senior Vice President for Quality, Safety, and Transformation at Cincinnati Children's, the first Executive Director of the James M. Anderson Center for Health Systems Excellence, and Executive Lead for Community and Population Health. Uma has been a pioneer in the application of system science to improve outcomes in healthcare delivery across the world, and in partnering to create the learning networks models to improve outcomes at scale. She is also a senior fellow of the Institute for Healthcare Improvement and the Carnegie Foundation. We are so thrilled and privileged that both of you could be with us today. And I want to start off with asking both of you a specific question, and I will start with you, Kathy. The Michigan Health Improvement Alliance is a mix of providers, systems, payers, and advocacy organizations. Can you talk a little bit about how having advocates at the table has influenced the work of the Alliance?
Thank you, Jocelyn. It's a great pleasure to be here with you today, and thank you for your contributions and leadership to this effort. Starting off with the fact that it's a great privilege to be part of a multi-sector, multi-stakeholder collaborative, because we really do need everybody for those kind of system solutions. And in our 15-year history, the health systems have been with us from the very beginning. We've certainly had a journey of learning together and have been intentional about mindset shift and challenging ourselves to evolve over that time. And we, like so many in this country, have serious opportunities to close the gaps in equity. So we're not done. This is a long journey. I would say having advocates at the table is really so many benefits, but I'll touch on just three things. That's very useful in both the planning and strategic efforts as well as implementation. It brings rich insights and understanding and helps us see things that really might be blind spots if we're just focused on data or what our own experience or thinking is. And that's true, I guess, of all the sectors involved. And to some degree, everybody becomes an advocate for the people, because we keep that as our North Star. What's really going to make a difference for the people? And having both organizations and individuals with lived experience come into that advocacy role is helpful. The second thing I would say is that having the advocates or people that are immersed in the population of highest disparities brings just an unprecedented insights that we can't really get any other way. They own that space. And it also facilitates the expansion of trusted relationships and uses pathways that already exist in the community to help enable the progress, like by being involved with those advocates. And I would say the third thing is that advocates often in their comments will remind us of the constellation of challenges that face people with the greatest disparities, that it's not just one thing, that it's this layered on that, layered on these three other things, and that we have to really be sensitive to the full scope of challenges that are existing for people if we're trying to close those equity gaps. And it brings a certain level of accountability into the discussions.
Great, thank you for that, Kathy. And we're going to touch on a couple of those issues really around building trust and driving accountability. So thank you for putting those on the table. Uma, I'm going to turn to you. You know, so much of your work involves driving change in a large hospital system, and at the same time, also improving care outcomes for folks on the ground in neighborhoods, in local communities. And so I wonder if you could talk to the question of how important is it to get people like residents and folks from neighborhoods and community leaders and community-based organizations, getting them involved in sort of these broader efforts to look at equity and how systems can serve people on the ground better. What's your experience in sort of the types of folks that you need to engage?
I think I would say that it was clear for us that if we were to advance the health of children and have them thrive, that we had to do that not from the position of somebody in the ICU and solving a problem or someone coming to the emergency department, but we had to think about it in a much more upstream kind of way. So that really, after so many years of working on in healthcare, shifting to think about health right away required us to say it's not in the hospital, it's in the community. So once we decided that as a strategic plan, we could then become bolder and say that we're not there to meddle in people's lives, but we're there to bring the learning we have to sectors across the community. That started us by thinking about areas like infant mortality, but also then brought us to spaces like education and health and knowledge, so that we're thinking about the whole child and the whole family. And once we made the determination that healthcare by itself was not going to produce health, we then committed ourselves fairly deeply to get across to every sector. And once we get across to every sector, we can begin to think about health and healthcare in a very integrated way. To do that, then we had to build the capacity to change systems. So that was the second, one aha was, healthcare is not going to do it. We got to be out there. The second aha was, it's not just enough to talk about it or to intervene in acute states. We really have to build the capacity and capability of all of the systems in our city for us to solve these problems for children. So to do that, then we decided to use a model that we've used before, which was a network model, a learning network model, but now bringing in the broad community into that space and building their capacity to change systems. Is that so? So it's a big idea going across sectors with their own individual things and getting everybody together to say, here's a method by which we could get results. I don't know if I answered your question, but that's what came to mind.
Yeah, no, you did. You did, absolutely. And I think both of you really spoke to where I hope we can take the conversation, because you both talked about the importance of engaging diverse actors and folks who bring different perspectives to the table, whether they're advocates or folks in communities. And then, Uma, I think it was very helpful to talk about that, once you decide you need to be in the community, you also have to make sure there's the capacity actually to engage in a way that sort of drives answers and solutions that can actually have impact. So I thank you to both of you for teeing up the rest of the conversation. And I'm going to ask you a couple of questions that really help to tease out, hopefully, this theme of first, building trust and understanding in the community. And then secondly, sort of navigating the different governance and decision-making models that often are part of healthcare systems. How do you navigate those in a way and utilize the expertise that would come from folks on the ground? And third, to look at some of the funding questions that are implicated. And I will also just say to the audience that we will take some audience questions at the end, so people can be thinking about that as we are engaged in our discussion. So first, on this question of trust and understanding in the community. I think both of you spoke to the fact that healthcare institutions really need to understand some of the unique characteristics in their community, what are the drivers of inequities, and they need to meet people's needs in their communities and sort of get the information necessary to meet those needs. Can you both talk, and I'll start with you, Uma, and then move to you, Kathy. I'd love to hear from both of you. What are some of the ways that healthcare institutions and organizations can build trust with community advocates? What have you seen that's worked? And if you have practical examples, that would be great.
I think that for us, certainly, there was no way that we could go into the community and just one more time talk about how great we were without recognizing and acknowledging where we had not done well. So we begin first by saying there's a lot more we could do, and we need to do it. Second, we do have the kids in our systems, in our care, visiting us, and parents. So we are not, so we begin there by saying, what do we need to learn? What are we not doing well? How do we think about this? And when we get deeper into asking those questions, for example, in Avondale, which is where the Children's Hospital is in Cincinnati, bringing a group of people from that community to say, what are we not doing right? You get a lot of answers. They come fast, the boards are filled, they're explaining about what you didn't do right. And so that humility and clear understanding from the community about where we are makes us then say, yes, we hear you, and we begin to do the work. And when we do that, and I wanted to say that the first item in this work is trust, because they are trusting that we're not going to drop the ball one more time. And we are wanting them to have the faith that we can do this work with them, not for them. So activating the community, building the leadership in our neighborhood, having them speak up in meetings to say, yep, but you might be doing it that way. You might think you're doing it that way, but that's not what happens. Brings all of these things into mind. And then with closer design work and deeper time, we begin to understand the lay of the land, the big gaps that exist, what we haven't done well, what we could do better, and that none of that's going to come from the healthcare system itself. It's going to come from empathy and caring and working with the schools. And that then led us to a broader definition of health, which covered multiple sectors. So we're no longer simply saying you came to the emergency department and you waited 2 hours. Of course, that's a problem. But we're also saying that we are seeing children, so if we talk to the schools, we're seeing children that the schools would like us to get some help with, let's say on mental health. And we need to exist in a broader kind of way for all children to thrive. And when we do that, we can bring other sectors in and we can all work together. That has been a singularly important idea, the co-production. It's our job to help, but we're not the bosses. And then the deep capacity and capability building in every structure that relates to kids in Cincinnati.
Thank you so much for that. Kathy, I'll ask the same question to you. What are some of the ways that you've seen that you can build trust with community advocates?
Sure. Well, I will reinforce and support so much of what Uma said and not repeat that. But to add on that, trust does not happen overnight. And this takes sustained commitment, intention, and authenticity that you earn trust. It doesn't you don't command trust. So I think listening, inviting people, going to others' tables and not expecting them to come to you necessarily, but going out and being present on a sustained basis. That listening, hosting events, having open listening sessions where people are asked for their input and asking them to participate in a legitimate way. And some of our initiatives that we've done in the planning stage of the work. So start from the beginning and not sort of once things are running, we are welcome to come in and share some input. So I would say have this be sort of an intention throughout and follow the principles, many of which are in the action steps, are clearly laid out in the plans from Raising the Bar. I would say we've also, just to build on something I said earlier, which is really involving other organizations that are longstanding advocates. In our case, we've reached out and built with the Black Pastors Association, the Hispanic Leadership Council, the NAACP, the Youth Build Organization, Youth Development Corporation, tribal populations, and really sort of identifying leadership within those populations and acknowledging it, creating partnerships with them directly.
Great, thank you. So I heard you both said so many things that were rich, and so I want to make sure that I pull out a couple of themes that I thought were important. One is this notion of acknowledging failure. Don't walk in thinking that you know everything. Two, you both spoke about sort of a sustained commitment and being there for the long haul. Trust, I think you said, Kathy, is not is earned but not commanded. And Uma, you spoke about sort of having a broad definition of health and really learning that the challenges of folks on the ground cross multiple sectors. And so thinking broadly about how you engage. And I think, Kathy, you also talked about intentionality and sort of how you engage partners. So all of that goes into the trust and understanding. So thank you for that. I want to shift to governance and decision-making because you both know that once you have community advocates involved in sort of governance and decision-making structures, that can be a real turning point in terms of organizations really trying to advance equity. And, a lot of times people will get residents or patients on different boards or committees. I wonder if you could talk about some of the practical things that you've seen that have been effective in bringing community advocates onto those sorts of governance structures or decision-making bodies. How do you avoid sort of creating a narrative where it's really just to check the box, or situations where people from the community may be less familiar with the structure and less, knowledgeable about how to navigate it? What are the things that you can do to fully integrate folks from the community into the governance bodies? And this time I start with you, Kathy.
Sure. So although I mentioned we had a 15-year history and you mentioned our Thrive initiative, this is a bold or sort of radical big thinking effort we embarked on several years ago when we realized that it really was going to require transformation, that incremental actions are not going to move the needle and get us where we need to go. At that time, we've taken some additional actions that the whole effort around Thrive was to be built by, for, and with the community. And so that step change occurred. At the same time, there were other governance related changes going on. So it's just all these things are in context together. But our own board, and we examined our own board and said, we don't represent the full community on our own board, and we should have a racial and ethnic diversity on our board that really mirrors the community that we're serving. So at that time, we put out an open letter to the community and set a set of very aggressive actions that we would take and commitments to change that. And we had committed to changing our board within 1 year, which we did, and use that even as an example that other health systems and other organizations, so the multi-stakeholder collaborative. And so that's a governance action that is built on a very principled discussion and a participatory process. But in addition to that, the sort of more granular work. And I'll give the example of maternal and child health and our zero harm health initiatives. In both cases, we've brought in the planning cycle and in the ongoing work, individual advocates and organizations into the decision-making structure of that work. And a couple of quick examples of that. So the zero harm work on medication safety. We're working with senior centers who, seniors as a population are some that have the most serious adverse impact of medication harms, and doing work with patients, families, and caregivers, and reaching out to those, checking language issues, checking other practices and communication, checking our materials with them in the beginning phases. And so really including people up front in that work. And then in the maternal and child health, bringing in moms who were talking about their experience into our steering team and into the steering team meetings and participating with us in that process.
Thank you for that. And Uma, I'll ask you the same question. You know, how have you gone about integrating community advocates into sort of the governance and decision-making process? Any examples of how you've been able to do that effectively and to make sure that people feel like they're full participants?
So I think the setup that we have is a learning network model. In that learning network model, people of all types learn together. And as we build the data for each measure, it is the community that advises us on how we behave and act and what the real issues are. The design work allows us to work closely to go deep to understand what the substantial issues are, not at the surface. And as we build this trust with the community, we can begin to produce health together. So we're sitting together talking about why something that we thought was the best idea since sliced bread is not working. And the community, of course, is asking us earlier to get earlier and earlier to understand what's going on. So we shift from sort of an expert model to a co-production model, which has been very, very significant. We're also building the capacity of the community. So community leaders stepping up, parent groups, mothers groups, not only pleased with what's happening, but more importantly, challenging us to that. Well, for this reason, let's talk about why it didn't work well and what to do. So now we're in a space where we are together trying to solve the problems without coming in from an expertise position. And that has been critically important, as I think, you heard earlier, to trust. At the end of the day, in this space, when we're trying to change systems, the most important issue is, does the community trust us? Do they see what we are going to try to do together? Can they speak up and tell us when we are not in the right spot? And can we celebrate together? So as we do the network, those are present in our weekly work, in our monthly work, and in our quarterly work. So the parents sitting at the table saying, yeah, that worked really well, but you might have missed X. And as I think I'm hearing you say, the co-production is not just a word, it's really, really important. Because at the point that they don't feel like they can trust us, we can't go anywhere.
Mm-hmm. Well, thank you for that, for both of you. I think I hear both of you saying that you have to be intentional about this. And I think I thought the words you used, Uma, a learning model, was really helpful, because it's sort of baked into the model. and you sort of learning together. And I think a little bit of a follow-up maybe to both of you on this. Is there any work that you had to do sort of on the healthcare side to ensure that folks were really bought in? I mean, I think that implicit in my question about making sure that folks from the community feel comfortable in the governance model is making sure that they feel like they're equal partners, right? Like they're not just sort of being brought in for show, but they're equal partners to the work. You know, Uma, maybe your point about the learning model speaks to that. You know, I wonder, Kathy, do you have any thoughts about how you make sure that people really do feel like they're equal at the table in terms of governance?
Yeah, I think I would reinforce what Uma said about the learning model rather than the expertise model, and the fact that we are all in this together. It's about all of us solving together. And I think that this is a continual effort. I wouldn't say, well, we're there, everything is just perfect, right? And so is there more learning to do? Is there more work to be done at the health systems and in other sectors? Yes.
Mm-hmm.
Have we had some honest conversations about it? Have we really brought people together to talk about why this matters, why it's material, and why it's the pathway that will bring us benefit? Yes. And so I think it's an ongoing process, just like earning and sustaining trust. The continuous learning of how we work better together to achieve the progress we all seek and close the equity gaps that we own together.
Great, thank you. I want to shift to the issue of funding and resources, and I'm going to start with asking a question to you, Uma, that then I'll kick over to Kathy as well. You know, I know that people have heard in previous Raising the Bar webinars, there's been discussion about resources and having adequate resources and the funding and the capacity. Uma, you spoke about building capacity on many levels to really drive change. And, you know, my experience is that a lot of times the community engagement work is the last on the list to get the money and the resources, and not fully integrated into the budget. And have you seen some successes in terms of making sure that the community work is, you know, budgeted accordingly, and that the accountability pieces are really front and center in sort of how initiatives are structured? Any examples that you can?
Yeah, so two aspects to bring to the work. The first aspect definitely is that healthcare is the 100-pound gorilla. Do its part to use its resources to be able to deliver what needs to be delivered. So there's a healthcare part of it that needs to be cleaned up better, more sensitive, more clear, better and earlier understanding of issues, and not, building equity into the care system itself. So that's one part of it. I think the bigger part of it is the health part of it, which doesn't only come from, I have a cold and I need X, or I have asthma. It also comes from saying, if I have asthma and I miss school, for a few days, I'm behind. So we have to build this in a way that the children can thrive, that they are in the classrooms, that they are able to learn. So healthcare can do its part of it, but the health part of it, which is really mental health, confidence, ability to read, ability to thrive. I mean, if you can't read by third grade, you have an 80% chance of being in jail or unemployed. So if we as a healthcare system are only thinking about the healthcare component of it, but not saying to the schools, here's how we can help you in the mental health space, here's how we can help you in the data space, then I think we're building the community we want, with everything geared towards those kids to make sure that their trajectory is right. So in the Cincinnati public schools, for example, with whom we partner very closely as part of this network, they have done enormous work in the mental health space. Whereas before it might have been seen more in a healthcare perspective, now it's really part of their structure and their work, how they recognize children that are struggling a little bit, how they solve that problem, what the social workers do, what the school psychologist does. And so we're interested in that kind of space as well, because if we're thinking about all children thriving, we have to think about every sector that works with them. And we have been able to, partly because of trust, partly because of capacity, come together in this network structure where every one of those sectors is part of the work. I don't know if I answered your question,
but you did, and it really goes back to your point about sort of having a broad understanding of health, right? Like and sort of driving accountability across sector. Kathy, I wonder if you could speak to that too, and talk a little bit. What are some examples that you've seen of successful budgeting around some of this work and accountability strategies?
Yeah. And I'm so glad you asked that, because the budgeting and the funds to actually do the work is often one of the primary barriers. Mm-hmm. And so when we began our work on this very bold Thrive initiative, confronted that right up front and said, look, we cannot possibly get where we need to go without some cornerstone work in the funding and financing of this process and how we're going to do that. So that became a central theme of what we're going to do. And I'll give you a couple of examples. Even on capacity building, as we were building our dashboard and scorecard, which is a public domain data source for the community, and all sectors use it around the health and economic and demographic metrics in the community. One of the grants that we sought for that was to ensure that we had readily available, easily distinguishable equity reports, and that equity metrics were easy to find, and that there were built into the process so that those could still fuel. So it was built into a grant. It's built into the project budgets for specific actions. When you're building a work plan around something we're going to do, you have to build those steps right into it. And the other piece of it was just the thinking bigger about funding and financing overall for every aspect of this uplift for the community, and not thinking only of just traditional grants and fundraising, but looking at how are we integrating all the sources of funding, whether that's Black grants, whether that's the more recent ARPA funding, whether that's the capacity to bring in even impact investing dollars into the picture, and how, just as has been pointed out by Health Anchor Network and so many others, how do health systems use their treasury dollars, not just their philanthropy dollars? How do we look at all of those kinds of sources, donor advised funds, high net worth individuals, and really thinking big about who benefits, how might that be into case making, and how we tap into those broader sources of funding that maybe we haven't utilized fully in the past.
Great, thank you for that. I'm going to ask you a couple of quick questions before we conclude, and turn to some audience questions that I'm sure that folks will have. I want to ask you both if you can give me an example of some concrete learning from the community that maybe drove a change that you would not have made but for the community's involvement. Can you think of an example that you can share? And I'll start with you, Kathy, and then move to you, Uma.
I would say, speaking to our work with maternal and child health, which I know is near and dear to your heart, that just bringing in all the voices of moms and helping us to talk about really what they felt was respect or lack of respect, and whether they felt that they were legitimately listened to in their interactions with healthcare, and whether their own knowledge and expertise in themselves and that of their children was accepted. And so that has colored a lot of what we're doing. And more recently, we've started this Count the Kicks program, which is a nationwide effort really to help people count those kicks, but giving an empowerment to moms that they have a role, a legitimate role, and then working with healthcare to appreciate that and how they bring useful information in. But it's bigger than just the kicks. It's about acknowledging and inviting moms to be a key part of their own health achievement and that of their children. So I'm using that just as an example that came from this whole space of respect and trust and our legitimacy of their role.
Mm-hmm. Thank you for that. That's a wonderful example. I'll turn to you, Uma. Can you think of an example to share, but a learning from the community that really changed?
Yes. So the community is always there, always ahead of us, always more aware of what the real issues are. And what we have to bring to the table is some modesty and some listening and agreeing and working on what they see as the problem. So in that space of flattening the bar of understanding that they know more about what's happening than we do is where we begin our work. And where because without that humility, we don't really get their trust at all. Second, I think and I think I heard you say this, many of our community folks have incredible talent and skills and an incredible amount of capacity to come up with solutions, as they have been doing for a long time in a different way. And our presence there is really to support that, but they are the people leading that work. So this model of working with the community cannot work if the community doesn't trust the system, and the system doesn't know enough to do the right things unless they're deeply kind of embedded in the community. And that thriving model then extends to all sectors. So if you are in the schools, for example, in Cincinnati public schools, you'll see the social workers and their goal of how they're going to get this child to where they need to go. And we have numbers and diagrams and, spaces that allow everybody to say, this is what this child needs, and this is what I'm going to deliver to them. And that's the same if you're in the Ohio Department of Jobs and Family Services, where you're looking to locate parents and kids in a right setting with stability. And so we built the cross-sector work as part of the network so that everybody in the cross-sector has the capacity to do this kind of deep. They've already been doing the deep work. What they may not have done is reflection, keeping the data, looking at the graphs, asking what happened. And so that's really allowed to raise the bar to have people sort of work together very, very well.
Mm-hmm. Thank you for that. Both of you really, I think, highlighted the I love your words, Uma, the need for humility and I think both of you talked a lot about trust.
Healthcare can be difficult that way, so it's important.
Well, let me tell you, lawyers have problems with that too. Yeah. So we're all in the same company in that regard. And I think, recognizing the talent and the skills, and Kathy, you talked about that too. Moms had a lot to say, and it was important to listen. There's a question in the queue that I want to get to, but I want both of you to just maybe give some parting words of advice before I get to the question, which is if you had one piece of advice to share with folks about how their healthcare organizations can better engage with the community, and really work on advancing equity. What's the short piece of advice you give to them? And Uma, your hand is raised.
Yes, get started before you're ready. Don't spend a year planning. The learning comes in the doing and the perturbing of the system, not in the 40th photograph of something, that you've put together. Because when we go out there and learn, we make mistakes, we build community, we are honest, we say what we don't know, we then build a partnership of trust. And that partnership of trust will hold you for a long time.
Great. Thank you for that. Kathy, what piece of advice?
I love your boldness on get started before you're ready, but I would say, and sustain it. And so it's so important that the effort is sustained and that you trust in the process of that engagement. And it may feel a little uncomfortable at first, and yet the rewards will come. And I think then it's hard to hold back. One of our key learnings was that there's already great things happening in the community, but very often they're too small or without sufficient support or connectivity where they need to be. And so it's really important to pay attention to those nuggets of what those great things are that are happening that need growth, expansion, and nurturing and connection. And that sustained effort, because, the reality is we're not where we need to be. And nobody has achieved the health outcomes that we need to in this country yet. And so we've got to come together to make that happen.
Thank you both. There's a lot of agreement on the chat, just so you know. So thank you for both of you. We have one question that has been raised. So I'm gonna offer that up to both of you for your comment. And so the question is, understanding that existing initiatives in the community, understanding that there are existing initiatives in a community and contributing to those existing efforts rather than creating new things or duplicating effort is an important way to respect and build on existing expertise and power. And so the questioner asks, how might attendees intentionally do this? Do either of you have thoughts on, how do you basically respect what people have been doing on the ground and not duplicate effort, but hopefully enhance what they've been doing? Do either of you have thoughts about that?
I would say it's a combination, that there has to be this intentional effort to really understand what's happening already and to have communication processes that are two-way, that allow people to tell you, because you can't possibly know everything. Nobody knows it all. And so if there's transparency in the communication about what we're focused on and what we're doing, and we've built trust. So transparency is a partner with the trust that it helps to allow people to have the pathway to communicate together, because then you've given the space for that, saying this is what's we're investigating. And if there's trust, people will share what they're already doing, and to really be looking for that.
Those were my two words, trust and transparency. They come together. One without the other doesn't work. And in this work, especially when we're working with people who come from different disciplines, it's not all in the same healthcare space. That trust and transparency is what keeps us honest, listening better, agreeing to try, shaping kind of the conversation for the future. So those two things matter: how we behave, how are we trustworthy, are we listening well? The community knows a lot more than we do. Do we pay attention? So that I would agree very much with what you said, Catherine, trust and transparency. Can't hear you. I can't hear you.
You know what?
There.
I thought I was doing so well. And
You have been.
Thank you, Uma. I don't have any more questions in the queue, so I want to just maybe close out with a follow-up question that I wanted to ask that really came off of something that you raised, Uma, and Kathy, maybe you have a thought about this too, is that, Uma, you've made a real point about talking about expanding the definition of health and thinking about cross-sector improvements. I wonder, and you spoke a little bit about this, can you think of give an example of a situation where the healthcare organizations that have been supportive of community involvement and community change have been focusing on community priorities that are not necessarily healthcare delivery, right? Like, I think you spoke about like some school engagement, but could you give some examples or an example of that?
Yeah, so when my space is the kids. So in that space, for them to get from birth to thriving adults, there's a huge number of sectors that they connect to, and especially if they are not, single parents or are not wealthy, each of those sectors they relate to is significantly important in moving that child to success. Mm-hmm. So when we are working in that space, we want every one of those sectors to recognize what their gap might be. How quickly they get a child into a school, or how quickly they place a child in a space that's needed. Because as these children, if we lose a month, 2 months, these are big steps for kids. And so we want all of those sectors to just be honing in on here's a kid, here's the problem, here's what I'm going to do. So that we are able to get kids into the space that's necessary. So that requires work that's a little bit more crisp, a little bit more urgent, mm-hmm. Because the parents or the mom may not herself be able to. There are lots of these things they have to do in order to get something done. We want all of those sectors to really be proactive, to say, how do I get there? How do I take care of this kid? What do I need to do? I've got to get this done so that the kids are, moving on the track. I don't know if I answered your question, but that's what I think about most of the time, is why all these sectors are important and how much, when they work together, we can solve big problems.
You did answer the question. It was just, I wanted to make sure I teased that out a bit because you had mentioned it. I could talk to both of you forever. You are both fabulous, and thank you so much for giving us some of your time and a lot of your wisdom today. Uma, Kotagal, Kathy, Baase, you really helped us think through, how do we engage community folks and really in a way that drives equity in healthcare organizations. So thank you again. This has been a critical discussion. I want to end by also thanking the Robert Wood Johnson Foundation for supporting this project and really the work of raising the bar. And to all of our audience, thank you for making time today for the conversation. I know you're busy, but I hope you were enriched as I was by the conversation. And we've offered a few thoughts for you to think about how you cultivate trust and respect within communities. I also hope you will take some time to look at the Raising the Bar resources. They highlight what organizations are already doing, and they provide action steps and things that you can follow yourself, and really tries to speak to all sorts of health stakeholders. Please visit the rtbhealthcare.org to learn more and to register for upcoming webinars later this month and in October.
I'm comfortable with you sharing my email because there are some people asking for some information. So I just wanted to give you a heads up about it. Shall I just go ahead?
If you would like to, Uma, you can. I'm sure we can also follow up afterwards, but if you want to share, go ahead just in case.
Yeah. Thank you.
All right, thank you so much. With that, the National Partnership also has resources that applies the Raising the Bar framework. Please look at nationalpartnership.org. And finally, thank you. Thank you. Thank you to all of you for joining us today. I hope you have a great day. Again, thank you, Uma. Thank you, Kathy. Thank you, Robert Wood Johnson Foundation. And thanks to all for being a part of this wonderful discussion. Have a great day.
Thanks to you.